When a baby or a child has a serious infection, doctors may use a powerful type of antibiotic called aminoglycoside. Aminoglycosides can be very effective, but the dose has to be balanced just right. Too little and the treatment may not be sufficient. Too much and you increase the risk of serious side effects like hearing loss or acute kidney injury. Now, the challenge in treating pediatric patients is that children are still maturing. On the one side, you have body growth, and on the other side, you have kidney maturation that still continues in the first years of life. Now, these two processes, however, don't happen at the same speed. Current dosing guidelines heavily rely on weight and age alone. So in this study, we set out to understand what is really the impact of both body growth and kidney maturation on aminoglycoside drug exposure in pediatric patients. To investigate this, we used computational modeling instead of testing the doses directly in children. We created a virtual cohort of patients where each avatar in this cohort represents a pediatric term-born patient ranging from neonates to 12-year-old children. We then mathematically simulated standard dosing, and we checked if the drug exposure is in the expected target levels. So is the drug exposure high enough for an efficient treatment, and is it low enough between doses to reduce safety concerns? And what we find is that there are pediatric age groups, specifically young infants, where we don't see that we meet the expected drug exposure range that we would like to see. So this is really indicating that not only weight, but also kidney maturation influences whether a dose is both efficient and safe. So with our simulation framework, we can directly test which pediatric subpopulations fall short under current dosing guidelines. We can understand what is the impact of kidney maturation on drug exposure, and we can translate between therapeutic drug monitoring results and individualized patient care. To learn more about our research, read our open access article in Pediatric Nephrology. There you can find more information on our study design, on our simulation approach, and on all supplemental materials that help our finding.